The real challenge for the physician world is to get out of an environment of procedure-driven, episodic-driven, and you hear all the references to leadership and thinking in a new way, and that's going to be the real challenge, because a lot of what's required is a view of the world differently, and that is not being a doctor per se. That's thinking about how do I need an entire different effort on how the area of my expertise and the area of our niche needs to drive how healthcare is delivered in a different fashion, with the concept that I may have a hospital partner, I may have a payer partner, but at the end of the day, I've got to change how that healthcare model is delivered. And it's really not being in the OR, looking at what I'm fixing at the moment. And that's where we stand. And there's a really potential interesting opportunity on the future if we try to take the best, or maybe what is not the best of two worlds, to create something that works well. We know in the physician marketplace that most decisions are the old fire, ready, aim, right? Get me to the end point, let's make the decision now, and worry about all the research that should be done to support the decision after the fact. And we get frustrated on the hospital side that we've got too much ready, aim, and no fire. And if you could probably blend some of the mistakes that have occurred with firing first and not aiming, and some of the mistakes that occur with a long-term process to make decisions, and bring the physician process and hospital process together to make maybe a little bit quicker but not quite as fast decisions on how we drive healthcare decisions, that becomes something that should work well. So some other key considerations, and this really gets to be a mental thought process. Sometimes we think of a relationship as a transaction. There's a tendency, especially people think of CPAs as, oh, let's go look at them, find me the money, look at the numbers, give me contracts, let's look at all of those things, which is basically a transaction-driven approach. And we would argue that that's a huge mistake on the front end of a relationship to view what you're doing as a transaction. The real question is, aren't we building a program? It may start as a single specialty program, okay? It may start with sharing, two specialties sharing something, but at the end of the day, are we not trying to consolidate or combine a set of services to create something unique that really should not be a transaction-driven thought process until I say this is what the program looks like? And really, I think too many times we rush to the table and we want to know the endpoint, and we want to know the financial outcome, or what the contract looks like, and we've done nothing to design how we're going to live together going forward. And then we get caught up in arguing over the transaction instead of really spending our energy in debating or piling into what should our program look like when we're said and done.